And that doctor didn't know he would lose his job that night. In fact, he never imagined that he would ruin not only his job but his entire career. Because the nurse he was scolding was actually... The fluorescent lights of Mercy General Hospital cast their familiar harsh glow over the polished linoleum floors as the evening shift began to settle into its routine. The sprawling medical complex stood as one of the city's premier healthcare institutions, its reputation built on decades of exceptional patient care and cutting-edge medical research. The emergency department, in particular, was known for its efficiency and the expertise of its staff, who handled everything from minor injuries to life-threatening trauma cases with equal skill and dedication. Dr. Richard Caldwell adjusted his white coat as he made his way through the emergency department's main corridor, his leather shoes clicking against the floor with the confident rhythm of someone who had walked these halls for over 8 years. At 35, Richard had established himself as one of the department's most capable physicians, known for his quick diagnostic skills and his ability to remain calm under pressure. However, those who worked closely with him also knew that his confidence sometimes crossed the line into arrogance, particularly when dealing with staff members he considered beneath his station. Richard had grown up in an affluent suburb, the son of 2 successful physicians who had always expected excellence from their children. His path to medicine had been practically predetermined, and he had excelled at every step: medical school, residency, and now as an attending physician at one of the city's most prestigious hospitals. This background had given him an unwavering belief in hierarchy and the importance of maintaining proper order within the medical establishment. As Richard approached the nurses' station, he noticed an unusual amount of activity near the trauma bay. Several nurses were moving with increased urgency, and he could hear the distant sound of medical equipment being prepared. He glanced at his watch, 9:15 p.m., still relatively early for the emergency department's typically busiest hours. "What's the situation?" Richard asked Nurse Patricia Williams, a veteran emergency department nurse who had been working at Mercy General for over 15 years. Patricia was known for her competence and her ability to remain calm in crisis situations, qualities that had earned her the respect of both colleagues and patients. "Multi-vehicle accident coming in," Patricia replied, not looking up from the chart she was reviewing. "ETA 5 minutes, 3 critical, 2 stable. We're prepping trauma bays 1 and 2. Richard nodded, his mind already shifting into the focused mode that emergency medicine demanded. This was the type of situation he thrived in: high stakes, multiple patients, the need for quick decisions and precise action. He began mentally reviewing protocols and considering the resources they would need to handle multiple trauma cases simultaneously. As he moved toward the trauma bays to begin preparations, Richard noticed a woman standing near the supply closet, apparently organizing medical equipment. She was dressed in what appeared to be standard hospital scrubs, navy blue pants and a matching top, though something about her seemed different from the typical nursing staff. She appeared to be in her early 40s, with dark skin and her hair pulled back in a neat bun beneath a simple surgical cap. Her movements were methodical and precise as she arranged supplies on a mobile cart. Richard frowned slightly as he observed her. He prided himself on knowing every member of the emergency department staff, and he was certain he had never seen this woman before. Given the critical nature of the incoming trauma cases, having unfamiliar personnel in the trauma bay could pose a significant risk to patient safety. "Excuse me," Richard called out, his voice carrying the authoritative tone he typically used when addressing support staff. "I don't believe we've met. Are you new to this department?" The woman looked up from her work, meeting Richard's gaze with calm, steady eyes. "I'm Dr. Elena Morrison," she said simply, her voice professional but warm. "I'm here to assist with the incoming trauma cases." Richard's frown deepened. Something about her response didn't sit right with him. While she claimed to be a doctor, she was wearing scrubs that looked more appropriate for nursing staff, and he was certain he would have been informed if a new physician was joining the emergency department, even temporarily. "I'm sorry, but I'm not familiar with you," Richard said, his tone becoming more pointed. "Are you perhaps a nursing student? Or maybe you're here for a rotation from another department?" Dr. Morrison continued arranging supplies, her expression remaining neutral despite Richard's obvious skepticism. "I'm here to help with the trauma patients," she repeated calmly. "Perhaps we should focus on preparing for their arrival." Richard felt a surge of irritation at what he perceived as evasiveness. In his experience, when staff members weren't forthright about their credentials or role, it usually meant they were overstepping their boundaries or trying to assume responsibilities beyond their training level. "Look," Richard said, stepping closer and lowering his voice to what he thought was a reasonable but firm tone, "I appreciate your enthusiasm, but emergency medicine requires very specific training and certification. If you're a nurse or a student, that's perfectly fine, but you need to work within your scope of practice. We can't have people pretending to be something they're not, especially during critical cases." Dr. Morrison paused in her work and looked directly at Richard, her expression still calm, but with a hint of something that might have been amusement flickering in her eyes. "Dr. Caldwell, I presume?" Richard was momentarily taken aback that she knew his name, but he quickly recovered. "Yes, that's correct. And I'll need to see your credentials and understand exactly what your role is here before we proceed any further." Before Dr. Morrison could respond, the distinctive sound of approaching ambulances began to echo through the emergency department. The trauma team immediately shifted into high gear, with nurses and technicians moving to their assigned positions and medical equipment being wheeled into place. "The patients are arriving," Dr. Morrison said, turning back to her preparations. "Perhaps we could continue this conversation after we've taken care of them." Richard felt his frustration mounting. The woman's calm demeanor and apparent dismissal of his concerns struck him as both unprofessional and potentially dangerous. "No, we're going to sort this out right now," he said firmly. "I cannot and will not allow someone with questionable credentials to participate in trauma care." Dr. Morrison set down the medical supplies she had been organizing and turned to face Richard fully. "Dr. Caldwell, I understand your concerns about patient safety. However, I can assure you that I am fully qualified to assist with these cases." "Then show me your hospital ID," Richard demanded. "Show me your credentials. Because right now, all I see is someone in scrubs making claims about being a doctor without any evidence to support those claims." The first ambulance had arrived, and Richard could hear the paramedics beginning to transfer their patient. The emergency department was now operating at the controlled chaos level that characterized major trauma situations, with every team member focused on their specific responsibilities. Dr. Morrison reached into her pocket and withdrew what appeared to be a hospital identification badge. However, instead of immediately showing it to Richard, she held it in her hand as if considering something. "Dr. Caldwell," she said quietly, "I'm going to give you one opportunity to reconsider your approach here. These patients need immediate medical attention, and we should be working together to provide them with the best possible care." Richard interpreted her words as a continued attempt to avoid answering his legitimate questions about her qualifications. "I'm not reconsidering anything," he said, his voice rising slightly, despite his attempt to maintain professional composure. "You're avoiding my questions, you're being evasive about your credentials, and now you're trying to manipulate me into ignoring hospital policy and patient safety protocols." He gestured toward the trauma bay where the first patient was being brought in. "Those patients deserve to be treated by qualified medical professionals, not by someone who won't even properly identify themselves. So either show me proper credentials right now, or I'm going to have to ask you to leave this area immediately." Dr. Morrison studied Richard's face for a long moment, and he thought he detected a hint of disappointment in her expression. "Very well," she said softly, "if that's how you want to handle this." She held up her hospital identification badge, and Richard leaned forward to examine it more closely. What he saw made his blood run cold, and his stomach drop as if he had just stepped off a cliff. The badge clearly identified her as Dr. Elena Morrison, Chief of Emergency Medicine, Mercy General Hospital. Richard's face went completely white as the full magnitude of his mistake crashed down on him like a physical blow. Dr. Morrison wasn't just any doctor, she was his boss. She was the head of the entire emergency department, the person responsible for overseeing every aspect of emergency medical care at the hospital, and the individual who had ultimate authority over his employment and career prospects. "Dr. Morrison," Richard stammered, his voice barely above a whisper. I had no idea. I thought—" "You thought what, exactly?" Dr. Morrison asked, her voice remaining calm but now carrying an unmistakable edge of authority. "You thought that because I was wearing scrubs and organizing supplies, I couldn't possibly be a physician. You thought that because you didn't immediately recognize me, I must be lying about my credentials." Richard's mind raced as he tried to process what had just happened. Dr. Morrison was relatively new to the hospital, having been hired just 3 months ago from a prestigious medical center on the East Coast. He had seen her name in memos and had attended one department meeting where she had been introduced, but he had never actually worked directly with her before tonight. "Dr. Morrison, I sincerely apologize," Richard said, his voice shaking slightly. "I made a terrible assumption, and I realize now that I was completely out of line. You should have treated me with the same professional respect you would show to any colleague," Dr. Morrison interrupted. "You should have accepted my introduction at face value instead of demanding proof of my qualifications. And you should have recognized that questioning someone's credentials in front of other staff members and patients is not only unprofessional, but potentially humiliating and demoralizing." The trauma bay was now fully operational, with the first patient receiving immediate medical attention from the nursing staff and the resident physicians who had responded to the call. Richard realized that while he had been focused on challenging Dr. Morrison's credentials, she had been quietly ensuring that all necessary preparations were in place for the incoming patients. "I don't know what to say," Richard admitted, his usual confidence completely shattered. "I made assumptions based on— I don't even know what I based them on. There's no excuse for my behavior." Dr. Morrison nodded slowly. "No, there isn't an excuse, but there is an explanation, and I think we both know what it is." Richard swallowed hard, understanding exactly what she meant. He had made assumptions about her role and qualifications based primarily on her appearance and the fact that he saw her organizing supplies rather than standing around in a white coat looking authoritative. The realization of his own unconscious bias was almost as devastating as the professional implications of his mistake. "The question now," Dr. Morrison continued, "is what we do about it. We have patients who need our immediate attention, and this conversation is going to have to wait until after we've provided them with appropriate care." She turned toward the trauma bay, then paused and looked back at Richard. "However, I want you to understand that this incident will be reviewed and documented. Your behavior tonight demonstrated a fundamental lack of respect for your colleagues and a concerning tendency to make judgments based on assumptions rather than facts." Richard nodded numbly, knowing that his career at Mercy General, and possibly in emergency medicine entirely, was now in serious jeopardy. "Dr. Morrison, I want you to know that I take full responsibility for my actions, and I'm prepared to accept whatever consequences you deem appropriate. Right now, I need you to focus on patient care," Dr. Morrison said firmly. "We'll address the professional issues after we've taken care of these trauma victims." With that, she walked briskly toward the trauma bay, leaving Richard standing alone near the nurse's station, his world effectively turned upside down in the span of just a few minutes. As Richard slowly made his way toward the trauma bay to assist with patient care, he could feel the eyes of the nursing staff on him. Word of his confrontation with Dr. Morrison had already begun to spread through the department, and he could see the mixture of shock, disappointment, and in some cases, satisfaction on the faces of his colleagues. Nurse Patricia Williams approached him as he reached the trauma bay. "Dr. Caldwell," she said quietly. "Doctor, Morrison has been working hands-on with the staff since she arrived 3 months ago. She believes in leading by example and being involved in patient care at every level. That's why she was organizing supplies. She wanted to make sure everything was ready for the trauma cases." Richard felt another wave of shame wash over him. Not only had he publicly challenged his superior's credentials, but he had done so while she was actually doing important preparatory work that would benefit patient care. The next several hours passed in a blur of medical activity. The trauma patients required extensive treatment, and the entire emergency department worked together with the focused efficiency that had made Mercy General's emergency department one of the most respected in the region. Throughout the evening, Richard found himself watching Dr. Morrison work, observing her calm leadership style, her clinical expertise, and the obvious respect she had earned from the nursing staff and other physicians. Dr. Morrison moved seamlessly between administrative duties and hands-on patient care, consulting with specialists, making critical decisions about treatment protocols, and ensuring that every patient received optimal care. It became increasingly clear to Richard that she was not only qualified for her position, but exceptionally well suited for the challenges of leading an emergency department. As the last of the trauma patients was stabilized and transferred to the appropriate units for continued care, Dr. Morrison approached Richard near the physician's work area. "Dr. Caldwell," she said, "I need to see you in my office in 15 minutes." Richard nodded, knowing that this conversation would likely determine the future of his career. "Yes, Dr. Morrison, I'll be there." Dr. Morrison's office was located on the administrative floor of the hospital, just above the emergency department. The space was professionally decorated but warm, with medical textbooks lining one wall and several framed diplomas and certificates displayed prominently. Richard noticed credentials from Johns Hopkins Medical School, a residency at Massachusetts General Hospital, and board certifications in emergency medicine and hospital administration. "Please, sit down," Dr. Morrison said, gesturing to one of two chairs positioned in front of her desk. She took her seat behind the desk and opened a file folder that contained what appeared to be personnel documents. "Dr. Caldwell, I want to discuss what happened earlier this evening," she began, her tone professional but serious. "Your behavior raised several concerns that need to be addressed immediately." Richard shifted uncomfortably in his chair. "Dr. Morrison, I want to start by offering my sincere and unreserved apology for my conduct tonight. There is absolutely no excuse for the way I treated you, and I take full responsibility for my actions." Dr. Morrison nodded acknowledgement of his apology, but continued with her assessment. "Your behavior demonstrated several problematic attitudes that are incompatible with the values of this hospital and this department. First, you made assumptions about my qualifications based on limited information and, frankly, on my appearance and the tasks I was performing." Richard winced, knowing that her assessment was entirely accurate. "Second," Dr. Morrison continued, "when I attempted to redirect the conversation toward patient care, you persisted in challenging my credentials in a public setting, which was both unprofessional and potentially disruptive to department operations." She leaned forward slightly, her expression growing more serious. "But most concerning to me is the underlying attitude that your behavior revealed. You seem to operate from an assumption that certain people don't belong in certain roles, and that it was your place to police those boundaries." "Dr. Morrison," Richard said quietly, "you're absolutely right. I realize now that I made assumptions that were based on unconscious biases that I didn't even know I had. Seeing you organizing supplies instead of acting the way I expected a department chief to act, I jumped to conclusions that were both wrong and inappropriate." Dr. Morrison studied his face for a moment before responding. "Dr. Caldwell, one of the things that attracted me to this position was Mercy General's reputation for collaborative, egalitarian patient care. I believe that the best medical outcomes happen when every member of the team, from housekeeping staff to attending physicians, feels valued and respected." She gestured toward the emergency department below them. "That's why I work hands-on with supplies, why I talk to patients' families personally, and why I make rounds with the nursing staff. Leadership in medicine isn't about maintaining hierarchy. It's about ensuring that every patient receives the best possible care." Richard nodded, beginning to understand not just the magnitude of his mistake, but also the philosophy that Dr. Morrison brought to her leadership role. "However," Dr. Morrison continued, "your behavior tonight suggests that you may not share those values, or at least that you haven't fully considered what they mean in practice." She opened the personnel file on her desk. "I've reviewed your employment record, Dr. Caldwell. Your clinical skills are excellent, and your patient care ratings are consistently high. However, there have been several informal complaints from nursing staff about your communication style and your tendency to be dismissive of their input." Richard felt his heart sink as he realized that his problems might extend beyond just this one incident. Those complaints, combined with tonight's behavior, suggest a pattern that needs to be addressed immediately, Dr. Morrison said. I'm placing you on a 2-week administrative leave, during which time you will complete a comprehensive professional development program focused on workplace respect, unconscious bias, and collaborative communication. The words hit Richard like a physical blow. Administrative leave was essentially a suspension and would be noted in his personnel file and potentially affect his future career opportunities. Dr. Morrison, he said, his voice barely above a whisper, I understand that my behavior was unacceptable, but is there any way that we could handle this without a formal suspension? I'm prepared to do whatever training or education you think is necessary, but a suspension would be devastating to my career. Dr. Morrison's expression softened slightly, but her voice remained firm. Dr. Caldwell, I understand that this is difficult, but we have to consider the broader implications of tonight's events. If I don't address this situation appropriately, it sends a message to the entire department that disrespectful behavior toward colleagues, particularly female colleagues and colleagues of color, will be tolerated or minimized. She closed the personnel file. The nursing staff witnessed your behavior tonight. If they see that there are no meaningful consequences, it undermines my authority as department chief, and, more importantly, it suggests that this type of conduct is acceptable in our workplace. Richard realized that Dr. Morrison was right. His public challenge of her credentials had created a situation that required a public response, even if the details of his punishment would remain confidential. I accept the administrative leave, Richard said finally, and I want you to know that I'm committed to using this time to seriously examine my attitudes and behaviors. I don't want to be the kind of person who makes colleagues feel unwelcome or disrespected. Dr. Morrison nodded approvingly. I'm glad to hear that, Doctor. Caldwell, I want to be clear that this administrative leave is not meant to be punitive. It's meant to be educational. If you approach the training program with genuine openness to learning and growth, I believe you can return to the department as a better physician and a better colleague. She stood up from her desk, signaling that the meeting was concluding. Your leave begins tomorrow. HR will contact you with details about the training program and the requirements for your return to active duty. Richard stood as well, recognizing that the conversation was over. Dr. Morrison, thank you for giving me the opportunity to learn from this mistake. I won't let you down. As Richard left Dr. Morrison's office and made his way out of the hospital, he reflected on the events of the evening. In the span of just a few hours, his understanding of himself, his biases, and his place in the medical profession had been fundamentally challenged and changed. The next 2 weeks would be among the most difficult and transformative of his career. The professional development program would force him to confront uncomfortable truths about his assumptions and attitudes, and to develop new approaches to working with colleagues from diverse backgrounds. But perhaps more importantly, the incident with Dr. Morrison would serve as a constant reminder that respect and professionalism are not optional components of medical practice. They are fundamental requirements that apply to every interaction, regardless of the perceived status or appearance of the people involved. When Richard eventually returned to the emergency department, he would find that Dr. Morrison had continued to build a culture of mutual respect and collaborative patient care. The nursing staff noticed his changed attitude immediately, and his patient care became even more effective as he learned to truly value the input and expertise of his colleagues. Dr. Morrison, meanwhile, continued to lead by example, demonstrating that effective medical leadership comes not from asserting authority over others, but from creating an environment where every team member can contribute their best efforts toward the common goal of exceptional patient care. The incident became a turning point, not just for Richard, but for the entire emergency department, reinforcing the principle that everyone, regardless of their role, their background, or their appearance, deserves to be treated with dignity and respect in the pursuit of healing and helping others. And that's how one doctor's assumptions led to a career-changing lesson in respect and humility. Sometimes the most powerful lessons come not from textbooks or lectures, but from the moments when we're forced to confront our own biases and grow beyond them. If this story made you think about how we treat others in our daily lives, make sure to subscribe to the channel for more incredible tales of growth, accountability, and the power of true leadership. Hit that notification bell so you never miss a story that challenges us to be better. Thank you for watching, and I'll see you in the next one.